Welcome to the Hormone Harmony podcast, a place for women to get curious about their hormone health, their longevity, and learn practical tips for aging gracefully. Hormone Harmony is brought to you by Thrive Lab, a hormone health platform for women, offering affordable and accessible online hormone healthcare, prescription hormone therapies, weight management programs, and lifestyle coaching. Thank you for tuning in and enjoy the episode.
Hi guys, it's Angie McGough, nurse practitioner with Thrive Lab. Welcome to today's episode of Hormone Harmony. Our goal here is to help you live your healthiest and most balanced life. And today we have a really exciting guest, and we're going to be talking about the connection between hormones and oral health. So welcome Amber White. She's a dental hygienist. She's a passionate advocate for biologic dentistry. And she's going to talk to us with her deep expertise in oral health and to share invaluable insights of how your mouth can affect your hormones and your overall wellness. So welcome, Amber. So glad to have you here. Thank you so much for coming.
Yeah, thank you, Angie. I'm excited to be here and talk about this.
So can you tell us a little bit about your health journey and how it really pushed you and encouraged you to work in biologic dentistry?
Yeah, I feel like they kind of coincided, so like most people in the dental field, we graduate with a traditional degree, we go back into working in traditional dentistry. But as I was practicing, I was always looking for more holistic options for my own health. And, just 3 years into practicing in traditional dentistry, I could see that there was something missing and really that there were so many other things that we could explore for our patients. I happened to land in the perfect position where a biological practice was opening in my area, and I was able to start working there from the ground up, a startup biological practice, and at the same time was going through some of my own health things with hormones and fertility. And so it kind of just crossed paths, and for me, the oral health connection wasn't a major part of it, but I saw it so much for my patients in that practice that it just made me want to dive deeper into this connection that really isn't discussed.
Yeah, it's very similar to my journey in the medical side of things. I just felt there was more and just dove into that, and that's how I ended up here as well. But maybe maybe you can tell us a little bit more. What is a biologic practice versus a regular dental practice? Just explain that for us.
Yeah. So, of course, traditional dentistry, we kind of have been taught to treat the mouth in isolation. And, you go to a dentist for your dental care, you go to your doctor and then maybe you see a specialist for a specific system of the body. Biological dentistry really involves the body in the healing process and is really looking at how all of the systems in the body interact with each other and how supporting one area can benefit the others. Biological dentistry really looks at the safety of the materials that are using additional healing modalities to optimize your healing. So things like PRF and red light. So it's always looking to use the safest, most non-invasive approach, but also really supporting the body in the healing process and involving the body in the healing process.
Yeah, we are definitely a system of systems, and you can't isolate one from the rest because they all affect each other. So, speaking of that, how do hormones, specifically estrogen, affect our oral health? Can you explain that?
Yeah, so it's a deep topic. Our mouth really is the gateway to our body, and a lot of times we'll also hear it's the mirror. So we can see so much happening inside the mouth and what it's really correlating to in the body. But estrogen specifically, when we see an estrogen decline, estrogen is responsible for bone remodeling. It's responsible for reduced inflammation. It has so many processes. So our gum tissue, just to back up, our gum tissue contains estrogen and progesterone receptors. So when our hormones fluctuate, we see that in the integrity of our gum tissue. We see that in the imbalance of our oral microbiome. We see that in so many things. So when we see like a decline in estrogen, we're going to see bone loss. We're going to see increased inflammation and bleeding response. We're going to see dry mouth. More certain bacteria are more prevalent in a mouth that has an imbalance of hormones. So there's just all of these things that we can see, but obviously all of these things that we can work on.
I definitely have understood the effect estrogen has on our bones in general, and then even vaginal health, microbiome down there, and the mucous membranes down there. I guess I've never connected to the mouth too, but that makes perfect sense that, as we go through perimenopause, menopause, a lot of women see a change in their vaginal tissue, increase in dryness, increase in UTIs, and that can be a direct correlation with your mouth mucous membranes as well. That makes perfect sense. So that is great information, and I don't know why I've never put that together before. But I do understand that our mouth affects our overall health. I think the gut health in general is just this booming area of learning right now, and we're really beginning to understand that there is just so much connection between our whole gut system and the rest of our body. So when it comes to our mouth impacting our overall health, how can this hormone imbalances really have a relationship with systemic health issues?
Yeah, so just speaking of the gut specifically, our mouth is actually the beginning of our gut. So we don't think of it like that. We think of it as like our stomach, our gut is this area down here, but this is where our digestion begins. This is where, we're taking food in. This is where we're taking nutrients. And so if we have an imbalance here, we're going to have an imbalance in our gut. A lot of times we'll do gut testing and we'll find bacteria that are prevalent in the mouth in those samples. So, it is this bidirectional relationship. But, when we think about our mouth, there's a lot of things that we look at in biological dentistry. Of course, like one of those is chronic low-grade inflammation. And so when we have chronic low-grade inflammation, we're at risk of a host of diseases in the body. But also the different things that could be happening inside of our mouth as hormones change. We have delayed wound healing, delayed repair. So we're more prone to infections in our mouth, which are linked to other disease processes in our body. We're more prone to cavities, dry mouth. We actually, like, when we lose estrogen, progesterone, and testosterone, we lose a lot of the muscle tone. We lose collagen production. So our gum tissue, our bone, our teeth have these large components of collagen. So when we're losing collagen in our skin, in our hair, in our nails, we're losing it in the integrity of our oral tissues as well. So there's just, yeah, this vast connection to really, there's 57 diseases linked to oral health, and it's all related. So whether it's a hormone imbalance that triggers that cascade or it's systemic disease, it's kind of like this, like I said, this interwoven relationship that it really is all connected. And it's not just this one direction relationship. Like if we have disease process in our body, we're more prone to disease in our mouth and vice versa.
And it can really affect, like you talked about, our risk for osteoporosis, losing our mineral components, inability to digest things, which then affects our micronutrient absorption, inflammation in our body. There's just so many things that are affected by our mouth. And like you said, this is the entrance for where all the nutrients we're putting in and start here. And we need to really take care of it. Again, if there is some issues here, it is likely throughout the whole GI system in our body. So really important to take care of our mouth. So how do we do that optimally at home?
Yeah, there's so much we can do at home. And so, that's the big thing is I think a lot of people tend to get overwhelmed from, what's happening inside their mouth. Sometimes we avoid it just because it's just too much to explore. But the one thing that I always really want to emphasize is that you have the power to change your health. And it's really these small habits that you can, add to your daily rituals and routines. So, we want to, if I'm just giving like home care recommendations, we want to swap out our products. We want to remove the toxins from our dental care. So, there's a long list of products. A couple would be fluoride, triclosan, sodium lauryl sulfate. There's a laundry list of these ingredients that are in traditional dental care products that are not only endocrine disruptors, they disrupt our oral microbiome. You know, Oral microbiome is this big term. Really, all it means is it's the bacteria in our mouth, and we have good bacteria and bad bacteria. And so, if we're wiping out everything we don't have that beneficial bacteria that is really promoting these natural processes in our mouth, which include remineralization of tooth structure, reduced inflammation, all these things. So that would be number one, is swapping out your dental products for something non-toxic. When we think about digestion, the first thing I do every morning is tongue scraping with stainless steel or copper tongue scraper. That's going to stimulate our digestive processes, but also remove that bacteria from our tongue, which tends to harbor overnight while we're sleeping. You know, Getting rid of, when we think about products, we're thinking about toothpaste, we're thinking about mouthwash. So we want to remove any of those products that say removes 99.9% of oral bacteria, because we don't want to wipe out all of the bacteria. We want to keep it in balance, just like we want to keep the systems of our body in balance. There's other things that we can add to our routine. When we think about tissue integrity, we think about collagen. One of the first things I'm going to think of is vitamin C, because that's that precursor for collagen. It's going to stimulate that. It's also going to boost our immune system, reduce that inflammatory response. So adding a good whole food vitamin C into your routine is going to be huge. But before any of that, I think one of the most important things is that we are creating a ritual around it. I always want to put on some type of guided meditation or binaural beats or something to really elicit that parasympathetic response when you're doing your routine, and actually making it something you enjoy and putting yourself in a place of healing.
Yeah, the parasympathetic nervous system is highly, highly underrated in the world today. And that is so important because we live in this world of fight or flight. We're just always high stress. We're always on the go. We eat on the go. We don't take time to bring ourselves down. So other tips for bringing us into that parasympathetic nervous system can be box breathing or humming, even singing. I tell my patients, sing in the shower. That vibration of your vocal cords will bring you down to that. That will initiate that vagal tone and will bring your parasympathetic nervous system into play and really bring that stress level down and help with those stress hormones, help to balance everything out. But it's good to pair it with something you do every day so that we do incorporate it into our daily lives. I was going to talk too about the endocrine disruptors. You flew over that, but that's something we deal with a lot with hormones, especially thyroid specifically, but estrogen as well. Fluoride does fight for those iodine receptors, which iodine is so important for any of our glandular tissue, so breast tissue, prostate tissue, thyroid tissue. And so fluoride is really one of the things that can be very challenging when we're dealing with thyroid issues, is that fluoride exposure and trying to get that out of your body. So those are all really important tips. But how do we find good products? Where do we find good products? How do we know what we're looking for?
Yeah, so like I said, there is this long list of products, and of course, yes, fluoride is one we definitely want to take out of our routine. I'll be honest, I think most of the products that you're going to find in your traditional pharmacy or store are going to contain some of these harmful ingredients. So it's really looking for the best products, and I can share links to some of my favorites, but it really depends. I always want to give personalized recommendations for your oral health. And so there's certain products that are going to be really beneficial for people that are more prone to getting cavities. There's going to be better products for people that are more prone to gum disease, periodontal disease. It really depends on what's going on with you specifically, but some products that I really like. So for toothpaste, there's a product called Revitin. It's a great product for anyone that has gum disease or periodontal disease, because it's all natural ingredients. It's going to have things like CoQ10, vitamin C, pre and probiotics that are going to help balance the oral microbiome. There's another product, another ingredient, nanohydroxyapatite, which is going to be for those people that are more prone to getting cavities, because it's going to help initiate that remineralization process of the teeth. Now, in an optimal, ideal mouth, we have a natural remineralization process. So the products that we use are important, but what's most important is bringing the body back into balance and making sure that we have this natural remineralization and we're not inhibiting it by anything. And so, monitoring the pH of our saliva, our nitric oxide, Really making sure we're digesting our food. We're actually taking a stop before we eat our meal and we're doing some deep breathing. We're initiating that rest and digest mode. And so all of these things are important to help keep balance in the oral microbiome.
Yeah, chewing appropriately is another
Mhm.
thing I find that I personally just bypass very quickly because I'm a mom and a nurse and I'm always on the run. But yeah, taking that deep breath, that parasympathetic nervous system before you even start to eat is very, very important and widely overlooked anymore. But those are really great tips. The nanohydroxyapatite, not something I'd ever heard of before. I'm definitely going to look for that now. But really important to know that we need to pay attention to our mouth. What are some other lifestyle tips that we can incorporate to help with oral health?
So, nutrition is going to be a huge, huge component of our oral health. So, what are we consuming? And so, when we think about that, we really want to make sure we're having the appropriate minerals and nutrient intake. We really want to up our fat soluble vitamins because those are so important for our gum, bone, and teeth health. We want to manage stress. We want to do all of the things. That's the thing. Our mouth is connected to our body. So all of the things that are going to bring balance to our other systems, we want to do for the mouth. So for hormones, we want to get that morning sunlight. It's going to help our mouth too because we need vitamin D for our oral health. We want to manage our stress. We want to do these things that help manage our stress and give us a more resilient nervous system. Because if we see these times of fight or flight and we're living in this constant sympathetic mode, we're more prone to disease processes in our mouth. So it's really all of these things that you probably talk about with with your patients and clients. That's the thing is they're going to help both. They're going to help your mouth and they're going to help your body. So it's not just, one area versus the other, which is great because there's a lot of things that you probably already are doing that are going to benefit your oral health. If you're having your green tea in the morning, green tea is a great thing for our oral health. So there's all different things that we can do, but I would say those are the really, nutrition, managing stress, sleep. Sleep is huge. So practicing that sleep hygiene, making sure that we are breathing through our nose throughout the day and during rest. So those are some really big things that we can monitor and also work on if we're not hitting all those marks.
Something that a lot of people talk about is oil pulling. And can you explain that a little bit, what that does and how you actually do that? What does that
Yeah.
entail?
Yeah, so oil pulling, it's a, ancient Ayurvedic practice. So you either use coconut oil, you can use olive oil or sesame oil. I love oil pulling. So, but these oils, especially coconut oil, which is probably the most commonly used, is naturally antibacterial. So, like I was saying with some of those products that wipe out all the bacteria, but this has those natural antibacterial properties. So, it's not something that I recommend doing every day, but I do recommend it 2 to 3 times a week because it's going to kind of wipe out some of that bad bacteria and allow us the ability to repopulate with good bacteria. I like the addition with oil pulling to add aloe vera juice. I like the addition of using an oral probiotic to make sure we're repopulating that good bacteria. But really, with oil pulling, what you're going to do is you're going to take your favorite oil, um, cold press coconut oil. You're going to just take a teaspoon of it, let it warm in your mouth, and then you're going to swish it. You can swish this anywhere from a minute up to like 20 minutes. It takes a time to build up how long you can do it. And you're just going to swish with that. It's going to pull the impurities out of your gum tissue. It's going to reduce inflammation. It does have natural properties that can help whiten teeth. And then once you're done with that, you're going to spit that in your trash can and you're going to do your regular home care routine. But I do think like 2 to 3 times a week would be ideal for that.
And then you mentioned red light therapy too. Red light, we know a lot of people use it for skin care, but specifically for the mouth as well. I have seen some dental products that you just put on your teeth and you just turn on the red light for about 20 minutes.
Hmm.
What does that do?
Yeah, so just like it does for your skin, so it's stimulating collagen repair. So, like I said, our gum tissue, our teeth, our bones are really made of that. So, it's stimulating the cellular response for us. The other thing it's doing, especially with women going through perimenopause, menopause with this estrogen decline, we see more cases of dry mouth. So, when we have dry mouth, we don't have the saliva that our tissues need for that remineralization. We're more prone to cavities, we're more prone to infections. So, there's a lot of studies that show that that red light photobiomodulation stimulates salivary response. So I have seen the devices you're talking about, and I do like them. The ones you just kind of, it's like a little bite guard with the red light on your gums. Those are great, and those are going to be really good for the tissue repair for those with gum disease, periodontal disease. But those with dry mouth, actually shining the light at the salivary glands, which sit at the floor of the mouth and inside the cheek, is going to help stimulate that salivary response.
So a little bit different device.
Yeah, yeah, it's more like a wand.
Yes. Okay, perfect. You mentioned nose breathing. What's the deal with mouth breathing and why is that important to realize that that can be a health hazard?
Yeah, and this is a very, very deep topic, but yeah, I mean, we are supposed to innately be breathing through our nose. It humidifies our air, it filters toxins, it produces nitric oxide, which we know is so important. So if we're not breathing through our nose and we're breathing through our mouth, we have decreased nitric oxide. We have drier tissues. And if we're breathing through our mouth, there's a reason we're breathing through our mouth. So is it something like sleep apnea or airway issues? So if we have something like that, our health is so affected. We're not sleeping fully. We're not breathing fully. You can do different things to train your mouth to stay shut. Some people do need some more like deeper interventions depending on the advance of that. But yeah, making sure that we're breathing through our nose is going to support our health.
So I've heard this thing called mouth taping. Is
Mhm.
that something that people use for mouth breathing?
Yeah, yeah. So mouth taping is great. Mouth taping is great for certain people. So if you can breathe fully through your nose, but your mouth tends to fall open as you rest or as you sleep, and that's something we can monitor through the day. Say you're watching TV or you're sitting just, does your mouth fall open? Same thing at night. Are you breathing through your mouth at night, but your mouth is closed for most of the day? Like you're a great candidate for mouth taping. It literally is just a little piece of tape that you're going to put over your lips to help train your mouth to stay closed as you sleep. So for some people, it's a great option.
I look over at my husband sometimes and his mouth is hanging open. I feel like that this happens as people get older, they lose their muscle tone here and it just tends to fall more often, which then leads to worsening gum disease and mouth dryness and all that stuff. So I see the correlation for sure.
And the hormone, the imbalance of hormones decreases the muscle tone in both our airway, in our jaw, how our tongue sits in our mouth. So that's, all connected as well.
Yeah, absolutely. What about teeth grinding? We see that a lot. Like people will get Botox to help with their TMJ so they're not clenched at night. What do you see are root causes for that? And what are some solutions?
Yeah, there's a lot of different things that it can be. Botox, I've seen a lot of patients use that over the years, but it's not really addressing the root cause. So, teeth grinding can happen for a number of reasons. First, we can think about our nervous system and being in a constant state of fight or flight. That's going to tend to have us clench and grind our teeth. It's also the way our teeth fit together. Our teeth are designed to really fit within each other. And so, if we have some misalignment of our bite, our teeth are always fighting to get into the right alignment. And so, we can tend to have that clenching and grinding. Clenching and grinding can be also linked to airway and sleep apnea. If we're like not able to breathe at night and we're losing that breath, we're fighting to keep our mouth closed. We're fighting to keep our mouth in a state. There's also links to things like parasites have been linked to teeth grinding as well. So there's a lot of different things to look at. A lot of times people will be recommended to get a night guard, but also that's not really addressing the root cause either. So it's really exploring, just like with any of your patients, we're always have to dive deeper because it's not the same answer for everyone. And so these are just some of the things that I'd want to look at.
And how do we dive deeper? Where do we look for answers for that?
Yeah, so I mean, I think always working with a practitioner who's going to help guide you. It's hard to find a lot of these answers on your own. So seeing a biological dentist is a great option. Working with someone who really understands these connections. I work with clients all the time on different areas of their oral and systemic health. So it's finding the right provider, but if it is something airway related, we want to see an airway provider, an airway dentist to do an evaluation. There's an x-ray called a cone beam x-ray that is beneficial for so many things, but one of the things it does evaluate is airway. Doing a sleep study would be important. With parasites, you want to work with a functional provider to see if that really is the concern. But things like testing your HRV, and just looking more into your nervous system. When are you clenching and grinding? Is it at night? Is it during the day? Is it during stressful times? Is it, you know, just so many questions I want to ask to know more.
Yeah, so for those of you who don't know, we have multiple podcasts, and actually I did one with the Worm Queen about parasites. So feel free to take a look at that one to get more information about parasites and how they affect us. It was a lot of fun working with her, but I'm a firm believer that all of us should be cleansed from parasites a few times a year for sure. HRV, for those of you who don't know, it's heart rate variability, and that just gives us a deeper dive into how our sympathetic versus parasympathetic nervous system is working. So you want your heart rate to vary, especially from sleep to wake and that type of thing. But some people who are under chronic stress, they don't have a lot of variability, and that can clue us in that we need to work on some of those things that you talked about, like the parasympathetic nervous system, vagal tone, that type of thing. So those are different things a functional provider can work with you on for sure. But from the dental approach, what is like a biological dental approach to like cavities or root canals or fillings? Like, how is it different, and what should we look for?
Yeah, so biological approach, like I was saying in the beginning, it really is about the safest, most non-invasive treatment. So when it comes to fillings, they're going to be using the most biocompatible materials. So biocompatible just means body friendly. It doesn't elicit a response in the body. So a lot of the materials that have been used for a long time do contain silver fillings or amalgam fillings. They contain mercury. They contain other metal alloys. So in biological dentistry, we're definitely not using those products, but when they are being removed, they're being removed safely through something called a SMART protocol, which it really just stands for the Safe Mercury Amalgam Removal Technique. So it's really making sure that we are gently detoxifying the body, protecting you from really breathing in any of those vapors. The other thing that some of the dental products can contain are things like BPA, fluoride, so making sure those are not part of any of the routine. I would say most biological dentists are going to start with, a really in-depth evaluation, probably not like you've had at your traditional dentist, and they really want to know more. You're also going to have something called a cone beam x-ray that I talked about a little bit, and that's going to evaluate your mouth, jaw, sinuses, airway on a 3D level, so you're able to really take a deeper dive into what's happening there. As far as like other dental treatments, like you mentioned, root canals, I would say the majority of biological dentists are not performing root canals. They're making sure, either they're doing biomimetic dentistry, which is a very specific type of dentistry to retain as much structure as possible. They're using things like ozone that are going to help, arrest decay and, seal off these tubules. Laser, PRF. There's a lot of different things that they're going to incorporate in their care.
Yeah, ozone is a hot topic that I recently started utilizing in my in-person clinic as well. It's great for so many different things. PRF, PRP, they're awesome as well. Biologic, different ways to promote your body to heal itself. There's a lot that I think we just ignore in regular dentistry, medicine, that type of thing. We do a lot of, at least in medicine, a pill for every ill versus getting to root cause and really helping the body heal itself. And our bodies are really remarkable, amazing, created things that are made to be able to heal themselves if they have the appropriate nutrition and cofactors and that type of thing, and we take away the toxins. So really focusing on that can be really, really important. How does hormone therapy, such as bioidentical hormone therapy, really impact the oral health of patients?
Yeah. So I mean, I personally love it because when we're not in balance, we're going to struggle with these oral health issues. So when we're bringing our hormones back into balance, we're going to naturally reduce our inflammation. We're going to have better healing responses. We're going to reduce the effects of, that loss of bone structure. We're going to increase muscle tone. So there's so many things that, we can benefit because, all of the things that are harming us when we have these plummeting levels of estrogen, progesterone, testosterone, if we bring balance back to our hormones, we're going to see, less risk of these oral conditions.
Yeah, absolutely. Again, when we approach bioidentical hormones or hormone therapy at Thrive Lab, we look at not just estrogen and progesterone for our females, but we're also looking at testosterone, super important for females. We're looking at testosterone for men. We're looking at thyroid. We're looking at lifestyle factors to really help with that parasympathetic nervous system, really making sure that really encouraging you to get good sleep, good nutrition. We have nutritionists on staff. We have lots of support to really help on this journey and work hand in hand with someone like you who focuses on the oral health side of things, biologic dentistry, which if we want to find a biologic dentist, do we just Google biologic dentist or how do we find someone near us?
Yeah, so sure, you can Google biological dentist and probably whoever's in your area will come up. There are websites that you can search on. One is IAOMT, and the other is IABDM, and they're going to list your local practitioners. So you can actually go on, choose your area, and then it will come up a list of the biological dentists in your area.
That is on my to-do list. Actually, I need to, a lot of my staff have been going to a biologic dentist here locally, and it's on my to-do list to get in to see her because it's just so exciting and just the connections to our overall health it's so important. So Amber, you have shared so much information and just really opened my eyes to a lot of things and hopefully to our listeners as well. How do we find you? How do we connect with you? What can we do to reach out to you?
Yeah, definitely. So on Instagram is where I share most of my content. So it's at naturally Amber White. You can also find me on my website, which is just naturallyamberwhite.com. And so you can connect with me through either place. Always open to having conversations about anything.
Wonderful. And for those of you interested in talking about hormones or some of the other things that we discussed from provider side of things, you can visit us at thrivelab.com. We have lots of personalized health solutions for you. And really our goal, again, is to help you on your journey to thriving in every aspect of your life and walking hand in hand with other medical professionals like Amber. But thank you so much, Amber, for just joining us and sharing your heart and information. It's like a whole new area that I don't think a lot of people are aware of. I'm super excited to have you. Thank you so much.
Thank you.
This podcast features guest experts in health and medicine and is hosted by our very own team of doctors and providers.